Welcome to today's research discussion on enhancing school-based health centers. Children in West Virginia display some of the worst health outcomes in the country and experience challenges in accessing high-quality health care. Over 1/4 of children live in poverty, and 1/3 of children live with obesity. School-based health centers, or SBHCs, provide reliable health care where most children find themselves daily, their local school. Although West Virginia SBHCs have provided care for over 20 years and to over 160 sites, we know little about their successes and challenges in addressing rural pediatric health care. Hi, I'm Whitney Sheridan from the School of Public Policy at Penn State. Today, we'll hear about the research on the challenges and successes of SBHCs. Before I turn things over to the research team, I want to encourage our attendees to join the discussion. We're going to leave time for audience participation, so feel free to type your questions at any point during the conversation in that Q&A box or the chat, and we're going to discuss them at the end of the presentation. Now, I'm delighted to welcome Simon Haeder.
Good afternoon, everyone. We're excited that you have taken the time to join us here today. We're going to start out with a brief introduction of the people that have been working on this project for the last couple of years now. My esteemed colleague, Dr. Sara Amadon. She is formerly a professor at West Virginia University and left academia a couple of years ago to join Child Trends, where she's now a senior research scientist doing all kinds of work related to child development, and most prominently, I think, the Tulsa School Project. And of course, there's me. I'm a professor of public policy here at Penn State University. I'm a trained political scientist, but most of my work has been done on public policy issues, including healthcare issues. This project, we should mention, has been generously funded by the Robert Wood Johnson Foundation, specifically by the Robert Wood Johnson Foundation's Interdisciplinary Research Leader Program, which has been a wonderful experience for Sarah and I to participate in. We had the great luck to be supported by wonderful research assistants over the last few years. And it's going to be really sad not to meet with them every Friday and chat. We had Emily Maxfield, who's also with Child Trends, who supported a lot of the qualitative analysis of this project. We have Kara, who's also on this call as well, and we'll be happy to take some of the questions later on, who's also a research analyst with Child Trends. And then previously, we had a Penn State graduate, Ambika Matur, with us, who was previously a senior research assistant with Child Trends and has now moved on to another position. And I'm going to hand it over to Sara now.
Great. Yes, wonderful to join you this afternoon. So I'm happy to share a little bit that we learned regarding school-based health centers in West Virginia. This project took a few different directions, and I'm going to start off by looking at school-based healthcare delivery in West Virginia. So first, it's important to understand West Virginia kids a little bit. And so here are some things that are important to know. Of course, when we think about providing school-based healthcare, it's important to contextualize the students, the children that we're thinking about. So there are roughly 360,000 children ages 0 to 18 living in West Virginia. And that is on the decline since 2015. And the entire population, in fact, of West Virginia has experienced a decline, resulting in the loss of a congressional seat most recently. Almost 1/4 of West Virginia's children live in poverty. Many, unfortunately, experience abuse or neglect. And unfortunately, West Virginia leads the nation in some of those metrics. However, it's important to note that an overwhelming majority, almost all of West Virginia children have health insurance. So what that tells us, and why that's important for this presentation and this study, is that all children can access healthcare in the state, can access and afford and have their parents pay for healthcare. And when we talk about school health, we need to understand a little bit about how many children we're talking about. So there are about 250,000 students in over 600 schools, in addition to some alternative schools and technical education centers. Almost 20% of students have an IEP, an individualized education plan. So they meet some sort of special education status under the IDEA. And about 1 in 4 public school students have a medically ordered care under the management of a school nurse. So school nurses also play an important role. And in addition to this, so while there are over 600 or 700 schools, about 170 of them have school-based health centers. And I'll note briefly, those school-based health centers can look different in each school. So it can include a clinic that's attached to the school that's open to community providers. And it could also include a standalone small room within the school as well. And we're going to talk about a few more of the characteristics of West Virginia school-based health centers as well. This is where the school-based health centers are located. So you can see the key there. The majority of West Virginia counties, and in West Virginia counties and school districts overlap, have at least one school with a school-based health center. There's a handful without, and many have, a majority or many of the schools have school-based health centers. And Simon, I'll turn it over to you.
Thank you, Sarah. Well, let me start off by saying, in some ways, we couldn't have taken or used a worse period of time to study school and healthcare issues at the same time, given what's going on in the world. But at the same time, there might not have been a better time as well. But as you can imagine, the ongoing pandemic that has basically overlapped the vast majority of this project has created significant challenges. But our goal has always been to start off and learn about school-based health centers by looking at what school-based health centers look like in the state of West Virginia. If we go on to the next slide, you'll see some of our work or some of the photos from our meetings. West Virginia is very unique in a lot of ways because, as you may know, West Virginia has a very, very challenging healthcare environment. It's predominantly rural. It's a very vast state with small population, no major population centers really, vast provider shortages, but incredible need, as Sarah just pointed out. And so we have a lot of negatives to work with in the state of West Virginia, but as Sarah just alluded to, there's one positive that we really found, and that's school-based health centers, which are more prevalent than in virtually any other state around the country. In West Virginia, we have predominantly health centers or school-based health centers that are funded or sponsored by federally qualified health centers or rural health clinics. We have a few that are sponsored by hospitals. That's very different from a lot of states. In Pennsylvania, for example, we have nonprofits running most of these. And so the background and the funding environment is very, very different from these. What we found out, and we might talk about this later as well a little bit more, is that the structure in West Virginia in place has really helped these school-based health center weather the pandemic relatively well because they could always fall back on their sponsoring organizations. School-based health centers, while they provide a lot of services, they obviously have to make money in order to survive. We have very little funding coming from governments at all levels to support them. So they have to often bill insurance, but they often waive co-pays and other fees in order to make sure that students really get access to the services they need. By definition, of course, school-based health centers are located either in a school or very next to a school. We've seen all kinds of different approaches here. Some say they're housed in a closet, right? In a room closet, basically. Any place that the school could find for them. Some are housed in the trailer next to the school. Lots of challenges that we can talk about more if you have more questions in the Q&A, but definitely some challenging healthcare environments for the providers to work in. Generally, they're staffed by physician extenders mostly, right? Because it's a very challenging healthcare environment and you have to make it work financially. So we have a lot of physician assistants and nurses. Every once in a while, we also have a physician, and of course, has to also oversee physician assistants and nurse practitioners as well. The idea behind the school-based health center is really fantastic. It goes where the students are, as Whitney said in the introduction, right? Students are basically in a school all day long. And so if you can move the healthcare providers in there, you can really make this work really, really well. And so we have a lot of opportunities by bringing the healthcare environment into the school to merge those two. Next slide, please, Whitney. We started out, as I said, by learning more about the existing environment in which school-based health centers in the state of West Virginia operate, and we took advantage of some of the groundwork that's been laid by people from Marshall University here that have collected data over previous years, and we kind of collected and visualized a lot of these data, and as we'll see over the next few weeks, we'll created a number of briefs that we're happy to publish and share with individuals, and you can reach out to me or Sarah. We'll be happy to share those. As you can see here, by definition, school-based health centers, they all provide primary care services. That's the essential definition of our school-based health centers. A lot of them have also moved into mental health services, and we have one mental health provider with us here today that will talk about the challenges and opportunities related to providing mental health care in West Virginia schools. We've also seen a stark decline in the number of school-based health centers that provide dental care, and what we found out is just making dental care work in a school environment is very, very challenging. It creates almost insurmountable challenges in terms of making sure the right providers are there, the amount of treatment that's needed, and the timing and all those kind of things. So we see a stark decline over time here. And then we have some school-based health centers that obviously provided all of the services at this point, but the vast majority, over 80%, either provide just primary care or provide primary and mental health care. Next slide, please, Whitney. What we've also learned over the last decade or so in the wake of the Affordable Care Act, we've seen tremendous growth in the number of school-based health centers in the state of West Virginia, and there's good reason for that. They seem to be working really well, and they seem to providers in West Virginia seem to have really found a way to make these work, but they also have been supported financially by some of the provisions that have come out of the affordable healthcare that specifically target school-based health centers and provide them with startup funding and some other grants to make this work. As you can see, back in 2012, there were only 58 school-based health centers, and we're now at 163, even at 170 if you look at the most recent data that we have available but not listed here. And even in the number of students here, we go from a low of 15% just about a decade ago to almost a third of West Virginia students now having access to these school-based health centers, which is something, again, that we should highlight and celebrate for. Next slide, please, Whitney.
Great. So what I'm going to do now is share a little bit what we learned from a series of interviews that we conducted across a couple of years to understand the experiences of school-based health center staff and administrators, and to really kind of understand what some of the opportunities and challenges are. So yeah, thank you. And a quick note, I will mention, as Simon has mentioned as well, so we started this project, as you'll see, in 2019, which is, we can think back to those blissful days when we had not heard of the word pandemic or COVID. So a few of the interviews were conducted prior to the pandemic, just so you will note that. I think the themes are really quite cross-cutting. And to be honest, we didn't focus on COVID when we did kind of pivot to that time. So in terms of what we did, there were 24 interviews, which each lasted about an hour. They included the CEO of a sponsoring SbHC, several medical providers and mental health providers, a health educator, and administrators as well, school administrators. The coding scheme was developed using priority codes with frequent co-codes to focus our analyses. We're really focused on kind of the questions that we asked to understand the characteristics and needs and development of these school-based health centers. And we had several coders and several analysts, including Kara and myself, to extract and understand these themes. So one of the first things that we learned and focused on was that school-based health centers are really interested in expanding their mental and behavioral health services. And so this was really underscored by, understanding kind of the needs, the community needs, the student needs. Mental health services really, from our interviews really across respondents, individuals identified that children really need support, affected by job loss, by the drug crisis, which was occurring prior to the pandemic. And sadly, we've heard it's even deepening during the pandemic. And then, of course, related to the pandemic itself. There are also staffing mental and behavioral health positions can be challenging. As Simon alluded to, West Virginia is a very large state with a few population centers, but by and large, really individuals are dispersed across the state. And so accessing that care can be a challenge. With the advent of some of the telehealth, we weren't able to get into this a ton. This may be addressed to a certain extent. And schools, families, and communities are really increasingly accepting of mental health services. So the schools and staff themselves are understanding the need and are making referrals. The families are really accepting of these services, and the communities also do see the need. And so we'll provide a quote here. The behavioral health needs have gotten a lot greater. The stressors of our kids are greater. The stressors of the families are greater. They're struggling over schoolwork. They're struggling on how to figure out how to do e-learning, obviously during the pandemic, virtual learning, whatever they need. They don't want to fail. They still want to be successful. I found behavioral health needs are coming through the door a lot faster than medical visits. And that's also, let's keep this in mind, thinking back to the slides Simon shared, that not all school-based health centers provide mental health services. So that we just want to contextualize that. That said, those school-based health centers still provide a very important resource, either for referrals or for helping to identify that need. Another theme is the partnerships with schools, communities, and families. So what we heard a lot was that schools can strengthen the service delivery, and that they are really instrumental in both enabling school-based health centers to be set up in the center, in the school rather, and to really provide important referrals from teachers to providers. In addition, there is a lot of recognition that it's important to partner with the medical community to provide additional services like dental care or mental health care to expand services to students. So I think this is an important thing to highlight, that these school-based health centers were not at all supplanting, or from what we heard, that they weren't supplanting pre-existing services, or they were more about kind of identifying additional need and then getting them connected to other services in the community or in the state. So in terms of prototypic quote here, the school staff, in terms of counselors and nurses and attendance directors, anyone else who can be worried about a kid, they bring that to our attention. So this is really referring to the importance of the referral system in terms of how the schools are really connecting with these school-based health centers. We also heard about the importance of partnerships with schools in terms of this partnership with schools, communities, and families. The SBHCs also can help support students' educational goals. So obviously, schools, SBHCs aren't meaning that, students are able to do necessarily homework better or that they're getting test scores better. But what they can mean is that that if students are in schools and are able to get their healthcare needs addressed in schools, they can actually stay in school, right? They don't have to be out of school. When I live in Monongalia County, when I have to get without school-based health centers, my children need a visit, they miss some school typically, just given everyone's scheduling needs, right? And so school-based health centers can really help, facilitate students' continued access. We also heard just about the incredible commitment of the providers themselves. And so this is an example here. The provider rides the bus home because she needs there to be a form signed that says she can see this kid. She knows that's the only way she can get the form signed, this consent form, right? I think it has a lot to do with the opioid epidemic and the families that have been impacted. Kids who have lost parents to the epidemic and who are being raised by who knows who. Kids that are raising themselves a lot of the times too, we see. So this is, again, speaking to that. In West Virginia, we see a lot of kind of dual generational or multi-generational families or grandparents raising children. And the schools, the providers themselves, the school-based health centers are really helping to support the needs of these students just in an incredible way. We also see that families are really keenly aware of the school-based health center, and the services that are provided are very supportive and welcoming to the school-based center staff and community. So we heard from the school-based health center staff that families were really willing to have their children seen, that they're typically, there really wasn't any, from what we heard, any concern about having students have access to the center, of having them even mental health care, right? Which often can be one that I think is a little more stigmatized throughout the US. So families are really aware, they're really receptive to their children receiving care. And we do see, that consent forms are signed, though it can take certainly some effort. And so here's a quote indicative of that. Whenever you walk into a community event, people know who you are. They know you're the one who provides these services. They welcome you. If they see you, they reach out, they talk. Most community people really welcome school-based health clinics, just because a lot of them, like I said, that's the only service there is in that area.
Thank you, Sarah and Simon. It's great to see so many attendees here today. And we'd like to open it up to our audience now for questions. And first, I guess I'd like to ask our project team a question before we get to the first one that we have here in the Q&A. How do SBHCs benefit students and schools in West Virginia?
Yeah, thank you, Whitney. Let me start off by answering that question. Thanks, Sarah, for outlining our work. I just briefly wanted to say that we're working obviously on more issues than we talked about today. We have a paper that we're currently working on that's under revisions that looks at the staffing challenges in SBHC. So there's a lot that we got out of this project, and we're just focusing on some of those things here. That being said, the way what we've learned both from the literature and our experience in West Virginia is that it's hard to pinpoint like a specific benefit that school-based health centers provide. But what we learned is that they make a lot of things better in schools, right? Sarah alluded to some of these things, right? They make it easier for students to access services, because a lot of students in West Virginia families face significant challenges in getting to the doctor. There's a provider shortage that's given, right? But then also their parents have to work often more than one job. They have transportation challenges. Sometimes the parents are absent, right? We have an opioid epidemic and other challenges in the state going on as well. Sarah alluded to the large number of children in the state that live with their grandparents. Sometimes the grandparents also have an opioid challenge and all those kind of things, right? Foster system, lots of kids in the West Virginia in the foster system, and so accessing services is a big challenge. And if we bring the healthcare provision to the kids in the school, that solves a lot of issues. If the improvement for utilization and access is definitely something it's there. There's also the facilitating role that a lot of these school-based health centers take on, right? They solve problems that students face. Like they may not be able to provide direct services, but we've seen dedicated staff that then take it upon themselves to make sure that prescriptions are filled, that prescriptions are picked up, that they get referred to the providers that can see them, that they can schedule dental appointments for them, even if the school-based health center themselves doesn't have a school-based dentist on staff, right? So there's a lot of benefits there. As Sarah alluded to, it means also that the kids don't have to miss class, right? They can just, stop by in the morning when they feel sick and be quickly seen, right? They can do all those kind of things. And a lot of them, school-based health centers also see teachers and staffers, which is an additional benefit, right? It's hard to find substitute teachers all around the country, but particularly in rural West Virginia. If a teacher just needs to quickly see someone and get maybe a prescription or something, that's a big benefit, not only to the individual students, but to the whole school community as well. And then lastly, what we've learned is it seems to, in a lot of places, the school-based health centers, particularly individuals working in the school-based health centers, are really active focal points of their communities, right? They're known by the students, they're trusted by the students, they see students and families in the grocery stores, they see them at the football games, and they are, really, really involved in their community, and they kind of bring everything together. And so they're really, really important to increase or make better the school climate, because they provide a trusting and often an individual that's there for long periods of time, where there's a lot of changes in the kids' lives undergoing. And so these individuals, like Jennifer, who's been there for I think about 20 years or so, they're in the communities, they're in the schools, they're the people trust, and so they are beneficial in many ways.
Great. And I would like to go to a couple of the questions that are coming in. Are SBHCs in West Virginia primarily in elementary schools, high schools, or evenly distributed across all schools? Sarah?
Sure. Yeah, I should have tried to pull this up, and I just noticed the question. School-based health centers are more commonly in high schools and middle schools than elementary schools, though there are certainly exceptions. One of the original large funders of school-based health centers, one of the original reasons it was they were developed was actually to address particularly adolescent healthcare, and that has since kind of changed, and you see more schools, including elementary schools, have them, but they are more commonly in the high school and elementary school, middle school levels.
Great question. Here's another really great one from a Penn State alum. What would be the best way for us to advocate for more counties to have these SBHCs, local, state, national? And what's the largest excuse for counties not having these? Fundings, concerns of parents not wanting their kids seen without them there. So what are your thoughts?
That's a great question. And I wonder too, if this isn't a good point to introduce Jennifer. I'm wondering if, I think it would be great potentially if she has any thoughts on this as well. So I think it would be just great, Whitney, if you want to introduce Jennifer.
Yes, I'd love to welcome Jennifer Taylor-Ide. She's a school-based behavioral health counselor at Pendleton Community Care in West Virginia.
Thank you. So if you want me to address that
would be
question great. About the best way to advocate, well, times have changed a lot. When our school-based health centers were first established, it was a very rough go. There was lots of resistance of all sorts. So there are several issues that probably would still be the same that you need to be aware of. One of them is just plain space. So, you have to, if you're going to approach a school system and say you ought to do this, then you need to perhaps be thinking about how might they do that. At this point, we have built several new schools in our county since the school-based health centers were established. And in each case, we were so established that they built the clinic spaces into the schools. What makes that incredible and wonderful is that means that, number one, the system has accepted this and has embraced it. And number two, everybody just gets used to it. The kids all know where it is, etc. So in our case, we have one of the most, maybe the most fully integrated models that I know of in terms of that our space is there. We share the space with the school nurses. So it's very collaborative. In most cases, our school-based health centers are very near the school office, which makes it easy to access administrators as well, and for parents to come in and out. In some cases, we have an outside door. Parents can come straight in or can exit, without having to go through the school. So that idea of space, that matters, because depending on where you are, that's going to be a big one. Another one would be clearly you want to do some research with surveys, county surveys or parent surveys or whatever. It kind of partly also depends on who your provider is, because there's a lot of, as this has been mentioned, a lot of them are federally qualified health centers, but are they there in that community? So differing, if your school is at a distance from the provider, then you're going to, among other things, take that as an important point, which is we have a provider over here in this town, we have a school over here in this town. Wow, big opportunity to bring our providers over to be able to see the kids at school. One of the biggest arguments in favor is simply that issue of working parents being able to have their kids seen and not have to leave work. Now, in our case, we have a pediatrician who's been staffing the medical side of ours for a long time. He may be the only pediatrician at this point in the state who's doing it. A lot of the providers are not at that level. But, he routinely, either if the parents can't come, then while he's seeing that child, he's got the parents on the phone. Okay, structure, building structure. Otherwise, what is it easy to get the medical care? And if it's not, then that becomes an argument. Another issue that has to be addressed sensitively is whether the schools feel that this is in some sort of way an intrusion into their space. So what you would want to do is gather information, such as from this research project, about how this actually it affects attendance, how it keeps kids in school, keeps them in classes, deals more efficiently with situations that would otherwise take the kids out, and how decent health and mental health actually provide are shown to benefit the academic outcomes. So schools are pretty much focused like this. They want their academic outcomes. They want their attendance and their academic outcomes. So just be aware, you're asking them to host something that they don't understand. So you want to be able to show them that it will help them achieve their goals. I hope that kind of answers how
that does.
Get
Yes,
that.
yeah, that does.
I just want to add one thing in terms of funding, and Jennifer, that on the ground perspective is so invaluable. We have seen in some of the budgets and some of the grant opportunities that have been coming out of the Biden administration, more of a focus on school-based health centers. So they actually have it built into their latest budget. Of course, that means nothing in terms of whether it will be, how and what will be passed. And in addition, there's also been some grant opportunities that are under the executive branch that are starting to come out that are really focused on school-based health centers. So I think there's a growing recognition that this is, really and important to a lot of Jennifer's points to things we learned in this study, that this is a really powerful way to help child health, to help, again, keep them in school. There's one thing I was going to add, but it's
think about it for a second, Sarah. Let me add one other thing just to piggyback, which is, don't forget that many teachers are also parents, and so that's another strength in your discussion, which is that teacher can have his or her kids seen for their appointments. And then it was mentioned earlier that sometimes the teachers themselves or the adults in the building can be seen. I don't remember the technicality, but there is a technicality about that required us to stop seeing the adults during the school day. We can see them after the school day. And it was a weird thing that our county school finance guy came across and said, oh, we can't be breaching this. Mm-hmm. And it was several years ago, and I can't even remember what it is, but just a heads up that you could bump into that.
Thanks, Jennifer. Actually, Sarah talked a little bit about this, but I wanted to ask Simon about policies that could or should support expansions of SBHCs in West Virginia and beyond. And we could potentially see that with some of this pending legislation. But Simon, do you want to talk a little bit about that?
Yeah, and I think that came across some of the Twitter conversation that our school public policy posts have ushered in with the school-based health providers in Pennsylvania. I think, and this is what Jennifer and Sarah alluded to, these decisions are inherently local, right? It starts at the local school and it starts at the local school district. Both of them need to be on board in making this happen, and then you need to have a willing provider organization that's willing to, shoulder the burden of coming in. I think that's where it starts, right? You need to have that starting point. A lot of communities are suspicious of bringing medical providers in the schools because they're concerned about what services might be provided and all those kind of things. So there's a lot of need for education and learning and dialogue right here, but that's where it starts. Then the second level, I think, is where different levels of policy come in, and that's where state and especially federal policy levels come in, is where these school-based health centers, they're a really, really efficient and effective form of providing care. They're really cheap compared to other medical providers and all those kind of things, but they do cost money, and they do cost money, especially to get established. And so what we've seen a little bit coming out of the Affordable Care Act and now the policies that Sarah alluded to is like, they need just a little bit of bump, providers to get started and get the established and get the equipment purchased and make the initial hires so they can get off the ground. So it's a multi-level policy decision decision that requires a lot of dialogue and cooperation. I think we're seeing more and more interest, and we're seeing more and more understanding how school-based health centers are important, how they can create a more equitable healthcare and educational environment. And we see some movement on this issue. It's also, and I think this is the last thing I'll say, and then we can move on to other questions. It's also a bipartisan issue. The latest bill that's been sponsored, and the West Virginia Senator Shelley Moore Capito is one of the co-sponsors, is sponsored by Republicans and Democrats alike. You just need to get enough people to understand, that these services are important, but then you need to get local people on board to do those kind of things.
I want to get to this next question. I think that Jennifer addressed some of this in talking about the roles that some of the individuals play in SBHCs, but we have a question here that says, with having SBHCs, do you eliminate the need for a school nurse, or do they involve the school nursing in this program? So Jennifer, can you give us your
that? Okay, so for many, many years, we had a school nurse who was half-time with the school system and half-time working with us for the school-based health centers. And we literally paid, the school system paid her salary, but we paid the school system for her time with us. And I can tell you, if you can figure out how to make that work financially and policy-wise, that was fabulous. She knew every kid in our system. Of course, we're rural, very small, but she knew all the kids. And that made a powerful bridge between any issues that would come up at school and issues that would come up in the healthcare center. We were forced to change that a couple of years ago, and I don't right now even remember the details. It's similar. We've had various things that have had to change, some kind of a policy, or there was not sufficient money, or we were paying money, but the school wasn't letting her have enough time to work with us, things like that. She still does, I think, maybe 1 4-hour time a week, and we, of course, try to keep in touch, but it's a loss. And I certainly feel it. And I know that our medical provider feels that loss, and she does too, because she had access to both records. She could get into Hbhcs on the school side, and she could get into our school-based health center records and could really track stuff. So absolutely no, these are not going to take the place of school nursing. School nursing functions somewhat differently and under different sort of rules and expectations and everything else. You definitely need that. But the more that you can make that collaborative, the better off you are. And the same holds if you have behavioral health. You want it as integrated as possible with the school counseling and school psychology contributions, so that you gradually learn, okay, here's where we go for this, here's where we go for that, here's who can bridge, you can talk some of the same language, that kind of stuff.
And I think this is an important point that Jennifer is making. Sorry to interrupt. It's important to understand there's a lot of confusion because it has the regulations of the school and education system and has the regulation of the healthcare system. And there's a lot of confusion often of what provider can do, right? There's this assumption that a school nurse can do a lot of things, but in West Virginia, they're highly restricted in what they're even allowed to do in terms of medical service. And so what Jennifer's pointing out, that there's need for all of these people. There's need for nurses, there's need for school health counselors, there's need for school-based health centers providing primary care, there's the need for school-based health centers providing behavioral health care, because they all are allowed to do different things and kind of hand off ideally between each other and make the needs of the student the foremost important thing. And so I think that's what we're trying to get at here.
That's exactly
I wanted to follow with what Jennifer was just saying about mental health, addressing mental health concerns and counseling, because we have a question here in regards to that. Do you think having more access to SBHCs can reduce the stigma of mental disorders for students, parents, and the community? And another question is that how does the insurance work with SBHCs? Can students get support insurance? What can students get support with insurance-wise for their mental health issues?
You want me to answer that?
Yeah, why don't you start that off, Jennifer?
Okay, I'll do the best I can here. Okay, so one thing in our school-based health centers, which I can't speak for others, we have a deal, which is we will bill, if they have insurance, we will bill the insurance, but we will not bill anything. And for behavioral health, we will not bill beyond that. And in fact, even the medical care, I'm pretty sure we won't bill beyond that. whatever the insurance will pay us, that's what we get. So what that means is mental health wise, that seriously ups the access. There's a lot of insurance that doesn't do a very good job with mental health services, but we just suck it up. Now, I say that because we have been able to get grant funding to help us. And that grant funding has slowly but surely gone down. And we are now facing a variety of very serious issues about how we can maintain what we've done and, make it work. So that's my best answer for insurance. I mean, the health centers do know. Just to back up 1 second, I need to make sure about this. We send out every year at the start of school, we send out consent forms for students to enroll in our school-based health center. If they are not enrolled in the school-based health center, we cannot give that service. But we have people, and we make it clear, we're not asking you to shift your primary care provider to our center. You can get your primary care somewhere else, but you can sign up for school-based health service at the same time. And once you've done that, to do that, you have to provide us with your insurance information, and we will bill if we provide a service. But again, if we think it's worth $150 and the insurance pays us $70, that's what we take. Okay. And in behavioral health, we go a further step and we get additional consents. I've lost track of the question that I'm answering, but it seemed to have to do with insurance, right?
So there was also the part about reducing the stigma.
Stigma, okay. So that one's a little tricky. I think that one could say it reduces stigma because at least in a small system, people become familiar. There are people who've worked with me for a long time. I mean, adults who've had me around, they really don't know. They still don't understand who I am, who I really work for, who's paying my bills, all that kind of stuff. But they do know what I do. And furthermore, I'm familiar to kids. So I've had kids who've said, well, you took so-and-so out of my class. Will you talk to me? Well, then if there's a reason, I can backtrack that. I can go to the teacher or somebody and say, there's something up with this child. Do you want to make a referral? Should I call this child's parent and see if it's okay for me to talk with them? So in that sense, a parent who might have said, no way that I'm going to walk into a mental health center or take my kid even into a primary care center and ask for mental health service. No, I'm not doing that. But yeah, if there's somebody out at school that they can talk to, sure.
Let me add something from our general, all our interviews here is something that it goes exactly with what Jennifer said in her context of her school-based health centers. The people that work in school-based health centers, they're different kind of providers than you get in the normal medical offices, right? They hang out with the students, they make sure to have lunch with them, they go to their football games, right? So they're around, they break down barriers that often exist. And so when someone like Jennifer or other mental health providers have lunch with you once a week, right? Your barriers or your personal internalized stigma of seeking help from them goes way down, right? Because your friends are talking to them if they need help. And so I think this barrier that existed for a long time has gone down, definitely, but mental health services are still a challenging services to provide because parents especially might be hesitant to take their kids and think about the implications, or is my kid going to be considered a weirdo or strange? Is this going to be reported anywhere, right? These things go away when the providers are in the schools, everybody knows the providers. And so it's an important, we see the challenges in the schools. We see the challenges in West Virginia schools with the opioid epidemic. Everybody's talking about school shootings all the time, right? These are services really that go a long way to doing those kind of things. But unfortunately, and this is something we haven't alluded to, in West Virginia, we have a relatively high number of school-based health centers. But the vast majority of schools in this country don't have a school-based health centers or mental health service. And so we have a long way to go to make school really a holistic experience that takes care of the needs of the child from not only education, but also food and mental health care and other services that make students perform better and create a more equitable playing field for all of us.
That's a great.
If I could just jump in here,
sure.
Back to the previous question about if you were involved in wanting to start one. Again, as long as you don't come in as if you're like alienating the functions in schools that I'm most aware of, the school nurse and the school counselors, they're not in the classroom, they're not the academic part of the school system, and they are well positioned to see the needs of the children. So as long as they understand that you're sort of coming in to help them and make their job easier, they are, they're great for, you know, diminishing stigma, because the school counselor can say, call a parent and say, you know, your child's been coming in to see me a lot and they seem kind of sad. And we have somebody here who I can't keep seeing your kid, but we have somebody who comes here who could. And so then they're bridging, you know, over to getting that help. And they're reducing the stigma because it's in school and it's easy and all that kind of stuff.
So we have a great question here about the application for 2 questions. Do you anticipate any challenges or recommendations for different implementation contexts like urban or suburban school districts?
I think that one thing I would note is certainly, I mean, you're talking about a different scale from what we've been talking about. You're probably talking about clinics that are going to be open longer hours. You're also probably talking about clinics, not in all cases, but in some cases, compared with West Virginia, you're going to see more hospital systems or even departments of public health that are sponsors for those centers, unlike in West Virginia, where FQHCs, federally qualified health centers, are really the primary sponsor. So, but the School Health Alliance has done a lot of work. They do a census regularly, kind of to find out where they're located. And I'm forgetting off the top of my head what their most recent statistics are, but they certainly are, you know, in all those contexts, you're talking about a different scale and sometimes for different populations of students, but the ideas are the same. And I also should note that just because you're in a suburban or an urban environment, it doesn't change the needs of students, of parents, and also the fact that you still could be in a healthcare desert. Like a lot of what we've been talking about here is in a lot of areas in West Virginia, you're talking about, you know, great distances at times to get, you know, healthcare. And so schools can really help minimize those barriers. Doesn't mean in urban areas you still don't have those same barriers, but in maybe different ways.
There's another question here, kind of following up on that. In thinking about post-grant funding, what are your plans and ideas for sustainability? Would there be any policy that can help with this, or mainly just providing technical assistance for providers? So taking it further.
Is that addressed at what I said about that we're going to be making a transition?
I think it's transitioning this for keeping the project going further and what you've learned from the project.
Well, it's a big question, and it's big issues, partly just because in the 20 years or more that we've had our centers, they're older than that, you know, a lot has changed. My view, to step back and get the big view, my view is that it would be a really good thing if this was just presumed in schools, the way a school nurse is now presumed and school counselors are presumed. They didn't used to be. There was a time when schools didn't have counselors and they didn't have school nurses. Mm-hmm. If we moved in that direction, then there would be funding sources that would move with. The trick right now is that, you know, you're sort of on your own. You got to figure it out. Who are you going to field and how are you going to pay for them? And in West Virginia, the Sisters of St. Joseph's has funded a number of us. They funded me for years, but the funding's going down and they're saying, okay, you know, how are you going to sustain this? And there is no one or no easy answer. The primary thing we're looking at is something called expanded school mental health, which I don't know if you guys talked with anybody who had that in their schools, but that is a very collaborative, community-wide approach. So you got to get all these partners, and you better have the schools thinking this is something they really want to do. So I personally think that I very much appreciate the work of bringing this forward, but I also think we're getting close to a tipping point. And in some ways, the pandemic might make that more poignant and around the country and make it more possible, where we really need to ask what is needed in order for children to succeed. And how are we going to deliver that? Because right now we're in crisis mode in our schools, and I think across the country, just even staffing the classrooms. And then get to trying to staffing the mental health, needs and so on. The whole public school deal is right now going through a knothole. And this is a good opportunity to do some redesign.
Well, I'd like to ask you about how Hbhcs play a role during the pandemic and post-pandemic period, actually, if you could talk a little bit about that.
How did we, or how will we?
How you guys how sbhcs have been playing a role, and during the post-pandemic period, what that might look like.
Well, those are two very different issues.
Right.
We all got hit with the pandemic, and so the first thing that, the schools just shut down. And honestly, what I did at first was primarily going out and helping with the school food program. And the same with my partner, who's not on this call, Kaylee Edwards. We just went and helped with the school, making sure kids had food. And then sometimes the kids would come in, and then they would see one or the other of us, and they would, oh, hi, and that kind of was a lift and that sort of thing. Clearly, we've tried to be sources of good information, but it's this rotating, it's like living in a revolving door system. And I'm sure you're aware of that. We'll have, a whole class is out on quarantine this week. These kids, so for me, it's been extremely disruptive. I never know. I go to all of our schools. I show up. I went last week to one of the schools. None of the kids I was going to see was there. They were all in quarantine. I couldn't have known that before I went, because I had to leave early in the morning to get there on time. None of them there. So I'm not going to be one to brag on what we've managed to do during the pandemic, because we've just done the best we could and tried to maintain our personal connections and, help where we could see help needed. And sometimes that meant a very different kind of help, like knowing, oh, okay, what we've really got going is a food service. Let's help with that. In the future, I think that some of the discussions we're having here, this is big stuff. I hope you guys are okay with us getting into this. But one of our principals, for example, has raised the issue that the pandemic itself, by covering people's faces and are having to tell kids all the time, oh, don't touch, no, somebody dropped their pen, don't pick it up for them. They dropped the pen, you might, oh no, don't do that, don't get close, don't hug, oh, somebody's crying, no, don't touch them. That we are effectively raising a group of young people who are going to be pretty socially confused about how to be connected. And that when we come out of the pandemic, we better have some ways to start addressing and correcting that. And we've created that to keep them physically safe. We've created this other thing. And that's before you even talk about the anxiety that they're living with. And that's before you're even, and then also how many of them may have lost family members, the grief. And then the ones where, one place you see the anxiety is that they don't want to come, some of them, if they're tend towards anxiety, don't want to come back to school. They've had these long chunks of time where they're doing it at home. Add on to that a lot of what they're doing academically is being done on a computer now. And it wasn't happening like that before, but we gave them, in our county, we gave them all Chromebooks and we sent them home to do school on computer. They come back. We still have some that are home. We're still doing a lot of classwork on computers.
Yeah, and I just add on to that briefly, and I know we'll need to wrap up, is that we did, during the pandemic, kind of our team thought through what things school-based health centers can and could do. And so one thing we've identified is facilitate access to things like vaccinations, and we don't have school-based health centers in Mon County, but we've partnered with pharmacies, for example, and that could have been a way to reduce a barrier and help facilitate that. And then thinking through other, chronic care. Unfortunately, some of these kids will have anxiety, depression, social issues. They also, unfortunately, some of them might even have long COVID, and so how can school-based health centers help fill that gap? And now I think either Simon or Whitney will be wrapping us up.
Yeah, one more thing to add before we wrap it up. I think one of the important roles, and this is obvious in some ways, is where school-based health center can play an important role is help getting kids vaccinated, right? In West Virginia, the data is shockingly low. Right now, only 3.6% of eligible children under the age of 18 are vaccinated against COVID. That is the lowest number by far in the United States, and that holds a lot of challenges going forward. And as you can see, this has severe implications for the work that Jennifer is doing, because the kids are sick or quarantining, right, for the foreseeable future if we can't get those numbers up. And so school-based health centers, they have a lot of important roles to play. Investment is clearly needed. With that being said, we want to thank everyone for making it here today. I want to specifically thank Whitney for taking the time to host us here today. And of course, to Jennifer taking time out of her busy day. It's been a pleasure working with everyone. And if you have interest in talking more to us about this, you can reach Sara at Child Trends, and you can obviously reach me at Penn State as well. Thank you again for joining us today and having a great time. We really appreciate it.
Been a pleasure. Thanks for listening.
Thank you, everybody.